Professor, thank you so much for joining us. Is the drastic action that we need exactly what we saw from the President last night? Is this the right move?
Well, thanks for having me. Well, what we, as you correctly pointed out, following experience from other countries, we know that if not contained, the growth of the number of people affected is very fast. We call it exponential, meaning a very fast growth, has already been indicated elsewhere. We were listening to President Ramaphosa's news yesterday with a certain degree of relief in that, given the current situation, it's very difficult to conceive any other measure different from levels of lockdown in order to curb the growth of the virus, indeed.
Yesterday, we saw new figures come out, and I think it went from around 274 up to 402. That is an alarming jump in one day. Is that in line, however, with how you map the development of this disease, where you came to the conclusion that 1 million South Africans could be infected within 40 days?
Well, the two preceding days over the weekend, the growth was actually very small, so that probably has to do with the kind of report we got over the weekend, and sometimes things spill over to the next day. Regardless, indeed, the continued growth was indeed alarming. We're still waiting for the data from the NICD to scrutinize the content of that data, so who among those were of local people that got the virus locally, and how many of them are people that got it because they traveled abroad. That's extremely important. The figure of merit here is the number of people that got the virus locally, and we suspect that number was growing quite fast. So indeed, it wasn't good news to have over 100 people infected in the country when you had about 300 only. So that was certainly a very important increase.
When it comes to modelling the virus, correct me if I'm wrong, but this issue of community spread is crucial. Is it correct that as soon as we hit 100 people spread locally, that's when it starts to spiral out of control?
That's what the data seems to indicate. This is the result of the analysis of a large variety of data sets coming from different countries. Different teams here in South Africa and abroad arrived at a similar conclusion. It's not an exact number, but it is around that number that when the number of infections reach that level, that indeed all the data we have, and I have that in front of me, indicates a fast growth in the absence of containment measures, of course, which is what happened in some countries where measures or advisories had been issued, but the population hadn't yet reached the point where the advisories were taken seriously enough. As a result of that, from a small number, you have very large numbers starting from 100 all the way to tens of thousands or thousands in a matter of 2 weeks.
Professor,
if you study the data, yeah, sorry.
Sorry, what I wanted to say is that now that we're going to go into a lockdown, obviously you're going to reassess your model. Will you then adjust it down to the risk of within 40 days 1 million infected? Is it possible to say what we can bring that down to? There's so many variables here. For example, we don't know how many people are in our communities who have not yet been able to get tested. But with the lockdown, will you be remodelling your numbers, and are you able to give us an idea of what those numbers might be?
Absolutely. We've been doing that with other countries that have implemented lockdown measures. And we are already parameterizing and understanding the slowing down of the growth. We're eager to get the data of South Africa this week to actually model it as well, so that we can predict more accurately what will be the spread during the lockdown process.
Well, we hope to catch up with you as soon as you have those figures. Thank you very much.